Hi, I'm Anat Loewenstein, and it is my pleasure to present to you our study on the quality of retinal images captured by a self-operated, home-based OCT system. These are my financial disclosures, and these are my co-authors. The presentation will discuss medical devices not clear for clinical use by the FDA. Home OCT has a great potential for personalizing neovascular macular degeneration management. By doing at-home OCT monitoring, we are trying to catch and treat wet days as soon as they happen, thereby providing patients and physicians with unique inter-visit disease knowledge. Such a flow has the potential to avoid undertreatment while improving visual acuity outcomes and reducing treatment burden. The COVID-19 pandemic further highlights the need for remote patient monitoring. For a home OCT system to operate, patients must be able to self-image on the OCT device. The analysis of the daily images must be automated and accurate. The device must be low cost but still deliver high image quality. And the patient's compliance must be monitored by a remote clinic. Let's start with the first two requirements. I'll present to you a study aimed to evaluate the self-operability of the Notal OCT by elderly patients with AMD. The study compared investigator image assessment for disease activity between the Notal OCT and commercial in-office OCT devices. It was a prospective IRB-approved clinical trial in which consecutive eyes with AMD, neovascular and non-neovascular, were first imaged in a non-dilated manner on a commercial OCT, Cirrus or Spectralis. Following a 2-minute tutorial by video, the subjects self-operated the Notal OCT to capture the OCT images of their own eyes. Images of the Notal OCT were then compared to commercial OCT images by a masked reader for presence of intra and or subretinal fluid in the central 10 degrees of the macula. Here you can see the investigational OCT devices. On the left, the previous prototype, version 2.5, and on the right, the version 3, which is the commercial form. It captures the central 10 degrees of the macula with 88 B scans and 34 microns spacing. We had more than 300 patients, more than 500 eyes, and more than 800 OCT scans. 88% of the version 2.5 and 93% of the eyes self-images with the version 3 were able to successfully complete the task. The visual acuity of the eyes that self-images successfully was better than those who failed. About 2/3 of the eyes were diagnosed with neovascular AMD and 80 to 90% of visual acuity of 20/80 or better, with about 2/3 with 20/40 or better. Of the 37 respondents, 91 of the users either strongly agreed or agreed with statements on the simplicity and comfort of the Notal OCT version 3. Comparing the identification of any fluid with the images from the version 2.5 Home OCT to Cirrus or Spectralis, the positive and negative percent agreements were all above 98 and 96 respectively. The agreement in identification of sub and intraretinal fluid were above 90% in all cases. Comparing the identification of any fluid with the images from the version 3 Home OCT or to Cirrus or Spectralis, the positive and negative percent agreements when looking for fluid in the first self-image was 89% and 97% respectively. Upon review for fluid in the first or second self-images, the positive percent agreement increased to 95% and the negative decreased to 95%. Upon review for fluid in the first, second, or third self-images, the positive percent agreement increased to 97% and the negative remained at 95%. Such review approach mimics repeat testing at the patient's home and shows the potential benefit of frequent OCT testing. You can see here the good image quality of the home OCT as compared to the Spectralis. We also analyzed the daily images in an automated manner. It must be automated and accurate in order to be functional. So the Notal OCT analyzer, the NOA, was used, and here is the process flow. The OCT output, the B scans, are used by artificial intelligence to segment the BIS scans for the ILM and RPE, and then quantify the fluid volume and provide a map, a fluid thickness map, as you can see here in the report of the fluid status, on the fluid thickness map, and in the fluid and in the graph. This is an example of longitudinal home OCT monitoring of intra and subretinal fluid in a patient undergoing anti-VEGF therapy. So at first there is a very small amount of fluid that is barely detected. This increases after 10 days, increases further, and upon a significant increase, which is seen on the BIS scan, on the map, and in the graph, the patient is treated, and you can see fast decrease after 4 days until complete resolution. So to conclude, the positive and negative percent agreement of fluid identification in at least one of 3 consecutive Notal OCT V3 self-images compared to commercial in-office OCT was 97 and 95% respectively. The tight 34 micron spacing between the BIS scans supports the intended use of Notal OCT as a retinal fluid finder. The Notal OCT meets the requirements to produce high-quality images suitable for reliable identification of retinal fluid by human graders and quantification by an AI-based algorithm. The low-cost patient self-operated OCT device may assist in monitoring of patients with neovascular macular degeneration and in their management. Thank you very much for your attention.